For my health summative this year, I chose to ask the question, how will teaching kids and teens about safe substance usage through harm reduction will help them become healthier adults rather than telling them not to use them? First, I will explain what harm reduction is and what abstinence is. According to many of the sources outlined in my bibliography, harm reduction is an approach that does not insist on abstinence and instead focuses on reducing identifiable harms that result from substance use. It can be described as an evidence-based, client-centered approach that seeks to reduce health and social harms associated with addiction and substance use without necessarily requiring people who use substances from abstaining or stopping. Harm reduction does this by acknowledging that many individuals coping with addiction and problematic substance use may not be in a position to remain abstinent from their substance of choice by meeting them where they are. Harm reduction allows for a health-oriented response to substance use, and it has been proven that those who engage in harm reduction services are more likely to engage in ongoing treatment as a result of accessing these services. Harm reduction accepts that a continuing level of drug use, both illicit and licit, in society is inevitable, and defines objectives as reducing adverse consequences. It emphasizes the measurement of health, social, and economic outcomes as opposed to the measurements of drug consumption. There is persuasive evidence that harm reduction approaches greatly reduce morbidity and mortality associated with risky health behaviors. An example is areas that have introduced needle exchange programs have shown mean annual decreases in HIV seroprevalence compared with those that have not introduced needle exchange programs. Some examples of harm reductions are any policy that recognizes that drug use and underage drinking occur while seeking to reduce their negative consequences, methadone maintenance, needle exchange, and server intervention programs. Abstinence is another type of approach where substance use is not allowed. For many years, abstinence has been favored because the impact of alcohol and drugs on young Canadians has been devastating. It has been thought that it's better not to use at all than to use in a safer way. This approach leaves many feeling like they do not have the support they need. When comparing the two philosophies, it is commonly believed that they differ when it comes to the concept of choice. While choice is a foundation of the harm reduction approach, it is not as apparent with an abstinence-based approach. A false separation has been made between harm reduction and abstinence. This is because people tend to focus on the differences between the two rather than what they have in common. Both harm reduction and abstinence can exist together. Harm reduction and abstinence share a core goal in common, which is to help people reduce the harms they experience because of their substance use. However, harm reduction is based more on a philosophy of starting where the user is at and offers a pragmatic yet compassionate set of strategies designed to reduce the harmful consequences of substance use. Now that you have an understanding of harm reduction and abstinence, I will tell you why I chose this question and its importance. I chose this question because I thought it would be an interesting topic to research on and because it is something I believe is important. I believe it is important to have this approach for many reasons. One reason is that I believe it creates a healthier, more open, and accepting environment for people who do choose to use substances. People who choose to use substances might feel like they can get help or ask about things more because the use of substances is not so shunned or viewed as something you cannot do and should not do, but rather as something that is common and that there is support for you. Another reason I chose this question is because many teens nowadays will experiment with different substances, and by teaching them safe ways of doing this and where to get help, then we greatly reduce the possible negative outcomes. They become healthier and more responsible. I would like to show you some statistics from the CAMH survey. This survey was conducted across Canada among students in grades 7 to 12. When you look at this infographic from the Centre for Addiction and Mental Health titled Psychological Distress, you can see the percentage of boys and girls from grades 7 to 12 who within the last month have felt nervous, worthless, depressed, that everything was an effort, restless, and hopeless. These groups of teens who are represented on this chart are some of the most vulnerable to substance use, especially the ones who do not have a support. This other graph from the Centre for Addiction and Mental Health Ontario Student Drug Use and Health Survey asked 11,435 students from grades 7 to 12 at 214 different schools about their use of substances in the past year. This graph shows that nearly 44% of students have used alcohol and that another 18% have used cannabis. Many of these students using the substances are students who were represented on the previous infographic. Without having an open support system for these teens, such as harm reduction strategies, they can end up feeling isolated with no support and have long-lasting health problems since they might lack the knowledge of substance use. Another way for them to feel less isolated or to participate in less risky health behavior is to inform the students about substance use. Abstinence has also shown to be unreliable for youth who are at the age of experimentation, according to the Harm Reduction Journal published in 2017 by Jenkins and colleagues. According to Sunshine Coast Health Center, programs that focus on preventing drug and alcohol abuse by scaring youth into abstinence are less effective than programs where teachers talk about harm reduction. Harm reduction is something that is growing rapidly, and even the Canadian Pediatric Society recommends that when healthcare providers are working with adolescents, you should advocate for the introduction, further development, and evaluation of evidence-based prevention and treatment programs that use a harm reduction philosophy in schools and communities. Fortunately, there are many resources that can help parents and teachers start discussions around harm reduction when talking to students about alcohol and drug use. These programs also could help schools implement harm reduction programs for their students. In Ottawa, the Youth Services Bureau has multiple programs in harm reduction. Two examples are the Hep C Youth Team, which focuses on the harms of hepatitis and ways it is transferred, including drug use, and the Sexual Health Youth Advisory, which promotes positive and open discussion on anything related to sex and sexuality, which helps teens become more aware of how to minimize risks when participating in sexual behavior. Another example of a place in Ottawa that has harm reduction programs is the Sandy Hill Community Health Center. Here they have addiction and mental health services which work on helping to reduce the harms associated with addiction. Finally, there are many websites where students can access information on reducing the harms of drug and alcohol use, as well as seek help if they are feeling in over their heads. One main website is Kids Help Phone. This program offers texting services and phone services where teens can get counseling and support. The second online source is an app called Drug and Alcohol Helpline. This app provides 24 hours, 7 days a week, 365 days a year service where you are provided with information about drug and alcohol addiction programs in Ontario. It also provides information about counseling services and supports in your community, as well as basic education about addiction services. Last but not least, this app can help you book your first appointment with a treatment provider. These are only some of the services you can find in our community if you are in need of support.